Hello and welcome. You're watching the SABC News Channel, independent and impartial. Thank you very much for joining us. I'm Peter Ndoro and this is SA Today. Now, the Council of Medical Schemes will be investigating claims of racial discrimination in healthcare. The Council made the commitment on SABC's Morning Live program today. The probe follows revelations by black and Indian healthcare practitioners that they're not being treated the same as their white counterparts by medical aid schemes.
A race row has erupted in the medical field over the payments of healthcare practitioners. The health workers also claim they're being exploited and harassed. After days of wrangling, the Medical Schemes Council has finally weighed in.
We are opposed to any conduct that includes racial profiling, ill treatment, harassment, bullying, coercion, entrapment and blacklisting of service providers, because all of these actions are not permissible by the Medical Schemes Act.
The council will now probe the claims levelled against medical aids. One of the aggrieved practitioners is Dr. Senatai Fisher, who's been a psychologist for more than 2 decades. Her practice collapsed following what she cites as bullying by medical aids.
I received a letter and they said to me, we are no more going to pay into your account, directly into your account. We are actually not going to pay even patients if they come to your hospital. We will not pay them. So in other words, they have practically closed down the business, and that is blacklist. And since then, December 2017, I've never been able to see a patient who is a member for Discovery Medical Aid.
Fisher is one of over 1,000 who claim they've been racially targeted.
This is total discrimination. Why did they just choose only white hospitals, but yet the majority of their members is black? They've got black membership here, and they're blocking the black patients from coming to us, and they encourage them to go to white hospitals.
This speech therapist was forced to shut down her practice after an audit. She says she signed an acknowledgement of debt under duress.
I was completely shattered. I felt stupid for signing at all, because I felt, why did I sign? But the intimidation and all the things they were saying, you know, I kept finding myself thinking about my children. Now, if I get arrested. I was tired of being harassed by the medical aids, especially Bonitas and James. My life has never been the same. It went from up there to like underneath. You know, from, if you were to say, from 10 to -20.
Once you sign that acknowledgement of debt, then you've put yourself now that you are a fraudulent, you have to pay them back. So that thing, it has caused many healthcare practitioners, the black ones, to commit suicide. It has led many black practitioners to be depressed.
The SABC sought comment from the implicated medical schemes about the allegations levelled against them, but only Discovery responded. They say they only acted against practitioners suspected of fraud.
Nothing could be further from the truth than the allegations that were made yesterday. These issues have got absolutely nothing to do with race, and they've got everything to do with fraud and billing abuse. We have no idea about the race. As I said, just consider the volume of claims. You know, it's 200,000 claims a day. It's machines that are doing this. They identify the risks.
But affected practitioners are not buying this. They'll be picketing outside Discovery next week. Gillian Pillay, SABC News, Pretoria.